and welcome to my YouTube channel. I'm Dr. Arti Thangudu. I'm a physician who focuses on diabetes, thyroid hormones, and other metabolic diseases. Please don't forget to like, share, and subscribe to help me get the message out on evidence-based endocrinology. Today, we're going to talk about the diagnosis of low testosterone in men. This is a very, very important topic, and I'll be honest, I didn't learn how to properly diagnose low testosterone in men until I became an endocrinology fellow. So I think this is a very, very important video for both patients and physicians. And this is based on the evidence-based guidelines by the Endocrine Society. So basically the overarching community that tells us as physicians how we should manage low testosterone. So first, I want to tell you a little bit about physiology. Testosterone peaks in the morning. So, as you may know, men tend to have erections in the morning. That's due to the peaking of testosterone at that time. The reference ranges for our labs are based on that peak value. So when we are checking testosterone, it is imperative to do it before 10 a.m. Otherwise, the reference ranges are invalid. You are supposed to have a lower testosterone in the afternoon than the morning. That is physiologic. So first things first, you have to check the testosterone in the morning before 10 a.m. for it to be even a valid measure. Now, you cannot just test any testosterone lab. The appropriate testosterone lab to check is testosterone by LC-MS-MS. That is a specific assay that is more accurate than the radioimmunoassays. And you can't just check that either. You have to calculate something called a bioavailable testosterone. That puts into account the body's binding proteins, albumin and sex hormone binding globulin, that can be lower or higher based on the person and based on perhaps other conditions that they have. So we have to check a morning total testosterone by LC-MS-MS, a albumin, and a sex hormone binding globulin all at the same time before 10 a.m. and then calculate a bioavailable testosterone. Typically, a bioavailable testosterone of less than 100 is considered abnormal or low. Now, there are factors that can make the sex hormone binding globulin go up or down. Factors that can affect sex hormone binding globulin are things like obesity, diabetes, kidney disease, thyroid disease, liver disease. So the sex hormone binding globulin can be quite variable from person to person. So it is very, very important to check this and add it into your calculation of low testosterone. As an endocrinologist, unfortunately, it is rare for me to see a patient who is on testosterone who has had an adequate workup. So that's why I'm making this video, to increase awareness of what an appropriate workup for low testosterone is for both physicians and patients. Because like I said, I didn't learn this until I became an endocrinology fellow. One major issue that we face all the time in the endocrinology world is that once you're on testosterone, we can't retest you. You have to be off of testosterone for weeks to months before we can retest and figure out what your body is actually doing. So it's really important to try to get an appropriate diagnosis before starting the therapy. Testosterone can be a very beneficial medication in men who have low testosterone, but can be very dangerous in men who don't have a true diagnosis of low testosterone. If you're concerned that you have low testosterone, make sure that you've had the appropriate workup as I discussed before. And it's okay to get a second opinion from a specialist if you're not sure about your original opinion from your provider. I hope this video is helpful. Please don't forget to subscribe and share with anyone who you think would benefit. Thanks so much for being here, and see you next time.